Our presentation is on evidence-based nursing practice.
The definition of evidence-based nursing is used to make quality decisions and provide the most efficient nursing care based on the most current and best external evidence, individual practitioners' clinical expertise, and patient outcomes and preferences. There are several steps to take to demonstrate evidence-based practice in nursing. They each start with the letter A, so this is a good way to remember it. Ask relative questions framing a clinical question or problem, acquire the best evidence and research, participate in facilitated appraisal incorporating clinical experience, apply the results to clinical settings, accommodate patient preferences, and assess.
Evidence-based nursing is important because it focuses on providing effective care to the patient's individual circumstances through asking specific questions and applying research to their own unique circumstances, allows the nurses to provide a better, quicker recovery for every single patient. It also allows medical personnel to think about where the short supplies can be best utilized for treating the patients and how to best suit their needs. It causes medical staff also to reflect on why they are doing the specific practices they are doing, allowing them to explore new fields and provide better care.
Florence Nightingale started evidence-based nursing practice before it was given its name in 1850s. She practiced evidence-based nursing by noticing that patients healed better by giving them warm soapy water instead of just plain cold water. And Cochrane in the 1970s started evidence-based medicine, which led into evidence-based practices and then evidence-based nursing, and was able to use evidence to decide which medicines worked and which medicines did not. And then David Satchett was the one that finally gave it the name of evidence-based practice and was able to implement those into hospitals.
Another important thing in evidence-based nursing practice is that it allows a holistic view of the patient to be achieved. So there are three main domains in evidence-based nursing practice: the best scientific evidence, the patient values, and clinical experience are all considered in evidence-based nursing practice. These three domains allow for the best care to be given to patients, as well as it allows the patient to feel heard and in control of their treatment more than other practices, because they can bring their concerns forward and it can actually affect the treatments that's being given to them. So it's very important to have evidence-based nursing practice to give the best care possible.
Some issues that evidence-based nursing practices have is that when a practice is discovered, it takes years for the practice to be implemented, even taking 10 to 20 years on occasion. A good example is nursing textbooks will not be updated, and incoming nurses will be trained on outdated practices, and it could take years for the new practices to be put in textbooks for these new nurses. And also, hospitals do organize refresher courses for nurses so they can keep up to date on their training, but they need to work on implementing new practices as well as reinforcing the old in order to provide the best nurses and best nursing care.
Okay, another issue is that sometimes the best evidence is not available, and that's because there are so many scientific discoveries and inventions yet to be made, and it is impossible for them to be discovered right away, as it can take decades for these kinds of things to develop. And so nurses who use evidence-based practice are to do the best with the evidence that they already have. And although it can take a long time for some discoveries to be found, many discoveries are found quickly and frequently. So the nursing world is constantly changing, and current scientific evidence can become outdated and irrelevant very quickly. Usually it is nurse practitioners that are responsible for finding new evidence, and in order for them to do that, to better the practice of nursing, it can take a lot of time and resources, since they need to develop skills that will help them find the best evidence possible. Sometimes doing so isn't possible, and practitioners must settle with the current scientific evidence they have and do the best they can with it.